Welcome to the Central Line Care and Maintenance Training Module. This training is provided for you by Teleflex, makers of the Aero Vascular Access product line. This training will review the following. 1. A review of the definition of a CLABSI, its causes, and its costs. 2. Strategies to reduce CLABSIs, including central line insertion bundles, care and maintenance bundles, antimicrobial technologies, and surveillance. This training should take you about 15 to 20 minutes to complete. At the end of this training, there will be an assessment which will be required to receive your certificate of completion. Now, let's begin. What is a central line associated bloodstream infection? A central line associated bloodstream infection, or CLABSI, is a laboratory-confirmed bloodstream infection in a patient with a central line at the time of or within 48 hours prior to the onset of symptoms. Also, it is ruled out that the central line infection is not related to an infection from another site. What are the causes of CLABSI? CLABSI occurs when there is the introduction of pathogens, both fungal and bacterial, into the bloodstream. This can occur in many ways. First, it can occur at the skin around the insertion site. Second, pathogens can be introduced from the hubs or connectors to the catheter. This can occur during manipulation of the IV tubing or drug delivery. Third, hematogenous seeding is pathogens that are in the bloodstream that colonize the catheter. Fourth, contaminated infusate can introduce pathogens into the catheter and into the bloodstream. Fifth, environmental factors can expose the catheter to pathogens. Routes of infection. Understanding the routes of infection are key to reducing risk in daily practice regarding central venous catheters. Routes of infection include contamination of the catheter hubs, contaminated infusate, contaminated skin organisms, contamination of the device prior to insertion, and hematogenous spread or thrombus or fibrin sheath. How is a CLABSI measured? CLABSIs are measured per 1,000 catheter days. This is a more accurate measure of an infection rate than a simple percentage and removes many variables like dwell time and the number of devices placed. This allows for easier comparison between different units and institutions. This number is generated by taking the number of bloodstream infections in patients with central lines and dividing it by the total number of central line days and multiplying it by 1,000. Using this formula, a CLABSI rate is generated. CLABSI risk and cost. It is important to understand the risk and cost of CLABSIs. It does not only impact patients, it also impacts the hospital financially. A CLABSI often extends a patient's length of stay while they receive treatment for the infection. The hospitals absorb an increase in the cost to treat the patient since CLABSIs are not reimbursed by CMS. The cost of a CLABSI has been documented ranging from $3,700 to $45,814, which would be absorbed by the hospital. Under the Affordable Health Care Act, CLABSIs are a core measure in value-based purchasing and a penalty under the Hospital Acquired Conditions programs. CLABSIs can cause a significant loss in reimbursement from CMS. Two proven CLABSI risk reduction strategies include the CVC insertion bundle and the post-insertion maintenance bundle. We will now review these two strategies in detail. Infection prevention starts before the catheter is placed using the IHI Central Line Placement Bundle. The infection prevention insertion bundle includes hand hygiene, maximal barrier precautions to protect the patient and the healthcare workers, chlorhexidine skin prep, proper insertion site selection, choosing the insertion site with the lowest infection risk, and daily assessment of central line need. The central line maintenance bundle includes hand hygiene, routine use of chlorhexidine impregnated dressings to reduce the introduction of skin pathogens at the insertion site. Note, this is institution dependent. No less than 5 to 15 seconds to scrub the hub to reduce the pathogens coming in through the needleless connectors or connective tubing. Effective securement to reduce the amount of catheter movement in and out of the insertion area. Sterile, semi-permeable, occlusive dressing to maintain a clean, dry, and intact surface area. Daily surveillance to ensure catheters are removed when no longer clinically indicated. Hand hygiene is an essential part of both bundles. Hand hygiene is required prior to all central line insertions and manipulations. When accessing injection caps, the catheter hubs, needleless connector hubs, and injection ports, disinfection prior to accessing is a must. Apply mechanical friction for no less than 5 to 15 seconds to reduce surface contamination. Some institutions choose to use an antiseptic containing hub, connector, cap, or protector to cover the connections between the lumens that are not in use. Dressing changes are of key importance. The changing of a transparent dressing should be performed with a chlorhexidine-based antiseptic every 5 to 7 days or immediately if the dressing is soiled, loose, or damp. Your institution's protocol may have a different time interval between dressing changes. See your institutional protocol. Change any gauze-type dressing every 2 days or earlier if the dressing is soiled, loose, or damp. Again, this may change or be different based on your hospital's policy and procedure. Use of a chlorhexidine impregnated dressing in patients over 2 months of age has been used by some institutions to reduce infections from the skin at the insertion site. A sutureless securement device can also be used to reduce the risk of infection for intravascular catheters. Flushing is an important part of care and maintenance. It is important to make sure that the catheter is patent and there is no buildup in the inner lumen of the catheter. You will want to assess the line for sluggish return or occlusion. Do you get a brisk blood return? If you have sluggish return or occlusion, you will want to treat the line immediately. When you flush your line, you will want to use an aseptic technique. Aspirate to confirm blood return and flush each lumen with pulsatile action. Always assess each lumen or the lumen that you will utilize before and after all medication deliveries in the manner stated. Maintenance beyond the dressing can include antimicrobial or antiseptic protected central lines as a protective mechanism beyond the dressing. Dressing changes are performed on a 5 to 7 day interval or when visibly soiled. But antimicrobial catheter technology prevents infections by killing pathogens that would attempt to colonize the catheter both extraluminally and intraluminally beyond the insertion. Chlorhexidine-based antimicrobial technologies exist to help protect patients from infection. AeroGuard technology is an antimicrobial technology for acute central lines, and ChloroGuard technology is an antithrombogenic and antimicrobial technology applied to long-term central lines. When selecting an antimicrobial central line, it is important to consider the spectrum of pathogens that the antimicrobial works against. A general antiseptic antimicrobial agent, like chlorhexidine, ensures that a patient is protected against all classes of organisms responsible for CLABSI: gram-positive bacteria, gram-negative bacteria, and fungi. The chart represents the broad spectrum of pathogens that can be responsible for a CLABSI and demonstrates that an antiseptic chlorhexidine-based central line protects against each of these organisms. Finally, catheter surveillance is an important part of the CLABSI prevention bundle. Central lines should be assessed daily for therapeutic need. If a central line is no longer needed, it should be removed immediately. When it comes to daily assessment, good surveillance is key. Be sure to inspect the insertion site, skin color, and overall condition along with the catheter route. Check the length of the external catheter segment to make sure that there is no more catheter in or out. Verify the integrity of the dressing. Investigate any edema, erythema, drainage, or leakage. Resolve any difficulty with the catheter using the flushing protocol laid out earlier in this presentation. Verify the infusion rate, pump occlusion alarm setting, and quantity of fluid infused each hour in your device. Check the IV tubing connections, status of the solution hanging, presence of precipitate or color changes in the tubing. Once a central venous catheter has been inserted, regardless of the insertion area, daily maintenance and line assessment should be assessed. Catheter dwell time can be directly associated with infection risk. Therefore, diligent surveillance processes should be followed to promptly remove unnecessary central lines.